this meeting of the House Children, Families, Finance, and Policy Committee. Nice to be with everybody. We are going to start, as usual, by having, and I know we've got a few members kind of making their way in gradually here, but we're going to start by having the clerk take the roll. Mr. Rohr, please.
Chair Pinto.
Present.
Vice Chair Keeler.
Present.
Lead Daniels. Present. Representative Burkle.
Present.
Representative Coulter.
Present.
Representative Davis.
Present.
Representative Hansen.
Present.
Representative Hemingson-Jaeger.
Present.
Representative Hicks.
Present.
Representative Walter. Hudson.
Representative Hudson's running just a few minutes late.
Thank you. Representative Katiza-Wattoon.
Probably the same, I suspect, yeah. Good point.
Representative Lee.
Present.
Representative Nelson.
Present.
Representative Perez-Vega.
Present.
Representative Zalesnikar.
Present.
Okay, we do have a quorum. Thank you, Mr. Rohr. I'm going to ask Vice Chair Keeler if she may to move approval of the minutes of our meeting from February 15th. There you go. Thanks. February 15.
Moving February 15th minutes.
Thank you, Madam Vice Chair. Members, any additions or corrections to the minutes of February 15? Hearing none, all in favor, please say aye.
Aye.
Any opposed? Okay, the motion passes. Thank you. And so, members, we are continuing today to hear about the impact of the funding that we approved in the 2023 session, today focusing on food security. And so we're going to be hearing about that, and then hearing several proposals to address Minnesotans' hunger and address some needs that continue, because we know that folks continue to be hungry in our state, and we know that we want to take action against that. So that is the plan. I'm just going to ask and see if anybody has any questions about our agenda or otherwise before we dive in. And then if not, we will start with the presentation on the impact of our funding from last session to address food insecurity. I'll ask Mr. Wojtak and Sophie Wallerstedt, make your way on up. And members, there is, I believe, the presentation in your packet. Yep. And so once you get settled in, whichever of you is going to go first, if you can please identify yourself, share your pronouns if you're comfortable with that, and then proceed with your testimony.
Well, thank you, Mr. Chair and members. Peter Wojtak, Government Relations with Hunger Solutions Minnesota, he, him. And
I am Sophie Wallerstedt, the Public Affairs Manager for Second Harvest Heartland, she, her. Thank you.
So, Mr. Wojtak, please proceed.
Thank you, Mr. Chair. And we're just happy to be here today to talk about the great investments that were made this last session and the work we had ahead of us to address hunger. So we first want to thank the committee for the very strong investments to address hunger this last session, including school meals for all, the state child tax credit, and specifically from this committee, the $5 million in emergency food shelf funding, the increase in base funds to the food shelves of $3 million per year for the Minnesota Food Shelf Program, the $7 million in one-time capital dollars to improve food shelf facilities and expand to reach more community members in need across the state, and funding to improve food access for tribal nations and SNAP outreach. All helped and will continue to help tremendously during these difficult times. I'll focus on talking about the emergency funding and the base funding first. So that money went out to food shelves participating in the TFAP program, or the Emergency Food Assistance Program, around 280 food shelf programs and partners and tribal nations across the state. All of those grantees received $5,000 in base funding, and the additional funds were based on the percentage of visits, statewide visits across the state. So with the increase in funding, many of the food shelves reported being able to keep pace without needing to reduce the amount of food given out. They were able to purchase more food along with culturally relevant items and staple items to meet the increased needs. They were able to stretch budgets and do things like store more food to handle more increase in visits. But the vast majority of that funding was used to purchase food, and it's the biggest anticipated need going forward. And I'll let Sophie talk about the other pieces.
Ms. Wallerstedt.
Thank you. And I will just talk real quick about the DHS initiatives that were passed last year as well, including $7 million in one-time funding for capital improvements. This RFP just closed and will be dispersed hopefully shortly. But the idea here is to increase capacity of food shelves by purchasing equipment and things for food storage. The second program, the RFP, opened last month, which is the Tribal Food Sovereignty Program, and then the new funding for SNAP outreach to support organizations that are reaching out to vulnerable populations that may be eligible for SNAP. Thank you.
Okay, yeah, thank you. Mr. Wojtak.
Yes, thank you, Mr. Chair and members. So statewide visits to food shelves have continued to rise. We've seen over 7.5 million visits this last year, almost 2 million more than the prior year, the record held in 2022, really showing no signs of slowing down at the moment. And then you can see on this next slide, it affects nearly every part of the state, with some
I'm
counties.
just going to pause you for a second. Apologize to members and members of the public for the slides being kind of difficult to see on paper, but hopefully folks looking at the electronic version can see. So, Mr. Wojtak, please continue. Just wanted to apologize for that.
Thank you, Mr. Chair. Yeah, so it affects nearly every part of the state, with some counties seeing increases, as you can see, 70 to over 130%. So with a growing number of working families in our state unable to afford food, it has put further strain on the emergency food system. We've seen now many shelves who are seeing an influx of new households visiting for the first time. They're seeing an increase in usage, struggling to keep enough food on the shelves. In some cases, many have had to adjust budgets to deal with needing to buy more food, and some have had to decrease the amount given out. So we know the need is not going away at the moment, but before we touch on the why, I'll let Sophie talk about the food bank perspective as well.
Thank you. So think of food banks as the wholesale distributors to food shelves across the state. There are currently 6 food banks in Minnesota, and we're going to show you some data from 2 of them, including Second Harvest Heartland, which serves 41 counties in Minnesota and 18 counties in western Wisconsin. This is a look at our distribution numbers for the past 4 years. Since midsummer last year, we have been distributing more food than ever before. And I want to direct your attention to that number in the top left corner, that 10.7 million pounds. We just got that number last week for our distribution in January. And so in comparison, we're up 20% in pounds over the same time last year. And then we'll move to channel.
I'm actually going to, can you just go back a second?
Yeah,
Just
of course.
because my brain is catching up, so maybe it's helpful to other people's too, that dot in the upper left, then you're saying that that's the January 2024 number.
Yes.
The lines below it, all those lines going all the way across, are the prior year numbers. So sort of January of 2024 is that much higher than the beginnings of the line below it from prior years.
Yes,
Okay,
that's
thanks.
correct.
Just catching my brain up. Please continue.
Thank you. And then you'll see a similar story at the Channel One Food Bank in Rochester, Minnesota. Their most recent data shows that their pounds distributed were up 26% over the previous year in 2022. Demand is already outpacing the capacity of the Hunger Relief Network, and this continued growth is unsustainable.
And so we've seen, many factors leading to this. A couple are food price inflation. So even though the rise in prices is slowing, it's still eating up many budgets. With wages lagging behind the rising costs, those increases over time have slowly built on themselves. And on top of that, we have the loss of many food support programs during the pandemic, like Child Tax Credit, Pandemic EBT, and Emergency SNAP, that all played a major factor as well. And you can see, for example, when emergency SNAP benefits went away, most Minnesotans on the program saw a decrease in their benefits by about $100 per person, so a significant cut to someone's monthly food budget, and has kind of put us in a situation where there's a hunger cliff for many out there, and it's part of the reason why we've seen food shelf visits begin to rise again. So there's many people who just literally don't know where their next meal is going to come from. And so these investments that were made last session helped tremendously. If we didn't invest in that way, things would look a lot different. Of course, there's more we can do to address hunger, and we have several bills today that we'll talk about and in the future to make improvements to SNAP that Sophie will highlight in a minute. But I'll just say that these would be the best tools that we can use right now at the moment to ease the burden on the hunger relief system overall. So again, just want to appreciate and thank you all for your investments to address hunger. We look forward to working with you to tackle this issue going forward.
And Mr. Whiteside, before we move on to the next section, would you mind going back 2 slides, the loss of food support programs, and maybe I missed this, but just if you can quickly, just in each of those things, just remind us about what those phrases are referring to?
Correct. Yes. Thank you, Mr. Chair. Yes. So we're just referring to the stimulus payments that were made at the federal level.
Sure.
And the child tax credit at the federal level that ended, unemployment insurance that was extended also during that time. We had the eviction moratorium as well, and that was so just the combination of all these things. Pandemic EBT was the benefit that went out to kids who were when you were out of school during the summer to provide funds on SNAP cards for that as well. An
So-
emergency SNAP. Yeah.
So all these are tied to the pandemic response, but then they, they all went away. Okay.
Yes, with the end of the pandemic, when all of those kind of you kind of had this cliff effect of families, seeing less in their budget because of that. So
Thank you.
Yeah.
Thank you.
Thank
Yeah. Ms. Wallerstedt.
Thank you. So I won't go into details for all of these today since you'll have time to do that. But looking at potential policy interventions, there are a number of levers that we can pull to decrease the need for emergency food assistance. SNAP is one big one. For every meal that a food shelf or a food bank provides, that's 9 meals that SNAP could provide. And I think the ED from Channel 1 will talk a little bit about that in a minute. But then you'll also hear probably later a few more proposals regarding vulnerable populations and their expanding access to SNAP for them. And then there are a few more proposals out there. I don't believe the Medicaid 1115 waiver will be in front of your committee, but it is something to keep an eye out for. And then as well as a funding for a Minnesota food bank program, which would be similar to the Minnesota food shelf program. Thank you.
Thank you so much. I know there are two more testifiers on the impact, and I'm thinking we'll go to them and then have further questions for you, unless anybody has a real quick clarifying question. So I'm not seeing any. So let's have Ashley DePover come on up, please, then. And we'll maybe make space for her if you can, and also Jason Viana. And then once you get settled in, if you can please identify yourself.
Yeah.
Sure. Yeah, thank you, and please proceed.
Yep. So I'm Ashley DePover. I work locally in Inver Grove Heights, and I have a husband and a 2-year-old. We struggle with food security in my household. We were homeless for 11 weeks 2 years ago, and then found stable housing, but had to completely restock an entire kitchen, which was challenging to say the least. We, on paper, make too much for SNAP by just a few $100s, but with increased food prices and just prices overall for housing and everything, it's been a struggle, and food shelves have really been a big support to our family. We actually utilize Open Door, and they make it so that I don't have to pick between feeding my 2-year-old and having electricity or gas in my car. And I'm able to give him some socialization opportunities that he wouldn't have had otherwise if I didn't have access to a food shelf.
Thank you so much for being here and for sharing your experience, because it really helps us to be informed then about the experience of people all over the state.
Yeah.
So thank you so much. Appreciate it.
Thank you.
Yeah. And Jason Viana, please identify yourself.
Yes, Jason Viana. I am the executive director of the Open Door. We're a hunger relief organization in Dakota County based in Eagan. We support, on average, around 18,000 individuals in our community every month. And we do that through a combination of ways. We have a traditional come and get it food shelf for those that have transportation and can get to us. It's about half the folks that we serve. We also have one of the larger mobile programs in the region where we make food available at more than 30 locations around Dakota County for folks that don't have transportation, whether that's a senior living community, an elementary school, or low-income neighborhoods that are food deserts and isolated from retail and transportation. I want to start my remarks with thank you for taking the time this morning to hear from us, especially from Ashley. Thank you for your courage, Ashley. I know that's hard to do. Yeah. But the investments that you made in the emergency food system last year paid remarkable dividends for us. I will tell you that much like the chart Peter showed, in 2019, we were helping around 5,000 people every month. And now we're helping around 18,000 people every month. And it costs more to help more. And the cost of food, much like you saw the reduction in pandemic benefits for folks in our community like Ashley, that also happened to the food banks and the food shelves. There was a lot of food made available that wasn't anymore. Our food budget as a food shelf has more than tripled since 2019. And the funding that you passed last year absolutely helped us keep our shelves stocked. And you also helped us as an organization create 1,000 new opportunities every month for families to access food. When we got news of the grant, it went directly into helping our folks. And so I'm truly grateful for that. And that's the supply side of the equation. I know we talk about food shelves a lot in demand, but context for a food shelf, when I think about us going from 5,000 people a month to 18,000 people a month, I don't think about that in terms of demand increasing. If you look back at Peter's chart of the visits, I think there's a missing line on that chart, and that's the line of demand in the community. And I think that it's easy to talk about surges in folks. We've never met the demand in our community. What we've done over the past 4 years is make historic investments in the capacity. I was trying to think of an analogy that would make sense, and the only thing I could come up with is PlayStations. When if you remember, your kids wanted a PlayStation 5 when they came out, and there was you couldn't get one. If they released 1 million new PlayStations, you wouldn't say demand went up. The demand was already there. Appointments at food shelves in our community, they're like PlayStations. There's many people that want them, and they just can't get access. So what you've done is help us build infrastructure to meet a demand that was already there. So we still have work to do. On the demand side, I'm very grateful for the child tax credit, for the investments that you made in universal free school meals, the investments you've made in affordable housing. Those are the levers that if you continue to push will release the demand and relieve the demand on food shelves. And so what you did last session was historic. We saw it, we felt it, and it made a remarkable impact. So thank you for noticing, and thank you for putting the money in a place that it helps us help so many.
Thank you so much. Thanks to you both for your testimony, for your work, and for sharing your experiences. Appreciate it. It sounds like there may be one more testifier that Virginia Merritt, that the folks who organized this should want to have come up. Yeah. Probably need to have you be pretty brief if you can, but so glad to have you, and please identify yourself and proceed.
Thank you, Chair Pinto, and members of the committee. My name is Virginia Merritt, and I'm the Executive Director at the Channel 1 Regional Food Bank in Rochester, Minnesota. We serve 14 counties in southeast Minnesota and western Wisconsin. We are a food bank, which is the warehousing for the food, and we are also a food shelf serving people directly. We are now serving more than 8,700 households per month. We were pre-pandemic, in the heart of pandemic, more like 4,000. That is 50 to 60 households every hour the food shelf is open. The total household visits are an increase of 47% from a year ago. This is demand like we never thought we would see. In 2023, our food bank distributed 13.9 million pounds. That was up 2 million over the prior year. We are at our absolute capacity for serving the community, and we thank you so much for the investments that you made last year and hope that you'll continue to make investments. Hunger is a statewide issue, and the rates in greater Minnesota are even higher than the state's average. We can be a leader and an innovator in expanding access to food for those who need it most. Thank you so much.
Thank you so much. Thanks for your work feeding folks in the community. Appreciate it. Thank you. Members, are there questions for any of these testifiers or questions about this, what we've had so far? And we're going to continue the conversation, I know, for the rest of the hearing and beyond. Looking to see if there are any. I am not seeing any so far. Okay, so we'll dive into our bills then. So Representative Hicks, can I ask you to head on up as you're able? Members, the first bill before us is House File 3426. And as Representative Hicks heads up, she moves House File 3426 to bring that bill before the committee. And I will apologize again for the challenge of reading some of the slides, but I think we've gotten a pretty good sense about both the impact and also the need. So Representative Hicks, your bill is before us. Please proceed with your presentation.
Thank you so much, Chair, and thank you so much, members. Today, I have a bill in front of you to increase SNAP benefits for individuals with disabilities. So what this bill would do is fill in the gap between what people already get in SNAP and what the maximum SNAP benefit is if they are a person with a disability. National data, I didn't actually know until this summer that people with disabilities are the most food insecure group that is tracked on the national level. And when I did some looking into why that is, there were a variety of hypotheses and reasons that were listed, many of which had to do with multiple streams of income, but low streams of income, specific information about what kind of food they need due to their disability and other conditions, and some other factors that were mentioned. And I thought that this might be an opportunity to address one specific group's need. We ask the disability community to pay a lot of money to exist and to be disabled in our state, and we hold them to different standards. And so this was an opportunity to try to decrease some of that inequity and to give people with disabilities money in their budget to be able to buy the kind of food that they need based on their needs. So thank you so much, Chair.
Thank you. We'll have your testifiers, then we can have a discussion about your bill. So Maggie Griffith is the first person here, and so if you can.
She isn't able to join us today. She's ill.
Oh,
So
okay.
sorry, Chair.
No
I forgot to
problem.
let
And
you
sorry, yeah, sorry, I didn't realize that. In that case, then Virginia Merritt, I think, can make your way back on up. Yeah, no problem. We had you, we got introduced to you, and you identified yourself before, and so you can please proceed and tell us your thoughts on this bill.
Thank you, Chair Pinto and members of the committee. You've already heard me talk about the unprecedented increases we've seen at our food bank and food shelf. And I'm here in support of one of the solutions, the Supplemental Nutrition Assistance Program, or SNAP, used to be food stamps. SNAP is the largest and most effective anti-hunger policy at our disposal. For every meal served by food banks in our country, SNAP provides 9. As I mentioned earlier, Greater Minnesota has disproportionately high food insecurity rates. More than half the state's SNAP participants live in Greater Minnesota. For this reason, Channel One strongly supports policies that strengthen the SNAP program, increase access, or expand eligibility to more food insecure Minnesotans, including those with disabilities. We know that people with disabilities experience food insecurity at higher rates. In fact, the U.S. Department of Agriculture calculated that adults with disabilities face food insecurity at more than twice the rate of their non-disabled counterparts. One of the primary benefits of SNAP is it allows the individual to purchase food they need right in their local communities. Many Minnesotans with disabilities require a specific diet, and we are unable to carry all the items that someone with a specific condition might need. When you go to a food bank or a food shelf, we're distributing whatever comes in the form of government commodities and whatever food we can rescue and get the best prices for. So we try really hard for variety, but for people with very specific diets, it's going to be challenging to get a majority of their food from us. Expanding the purchasing power for all eligible Minnesotans through SNAP would not only help increase their overall health and well-being through more specifically tailored diets, it helps grocery stores in our state, especially those in Greater Minnesota, remain economically viable, and that's critical for our rural communities. I'll end by saying that increasing access and resources to SNAP in this bill or other bills you'll hear before you today will decrease the crushing need that we're seeing at our food banks and food shelves. Thank you so much for your time and consideration.
Thank you so much. Thanks again for your testimony and for your work. And I'll note that there's at least one item in our packet, a statement from somebody named Katie Barton, I hope I'm saying the first name correctly, advocating on behalf of this. So with that, I think Representative Hicks, okay, for you, sorry, Jillian Nelson is another testifier. Yeah, please. Come on up. And once you get settled in, if you can identify yourself, share your pronouns if you're comfortable with that, and please proceed with your testimony.
Good morning, Chair Pinto and committee members. I'm Jillian Nelson. I use she, her pronouns. I'm the Community Resource and Policy Advocate for the Autism Society of Minnesota. Disability income is not substantial enough for most people to live independent lives. And this results in many people depending on food assistance and Medicaid to meet their basic needs. Unfortunately, the way the system is structured currently, it results in a significant impact to SNAP benefits awarded to people with disability income. A study by the National Disability in 2020 showed that people with disabilities pay over $17,000 a year more than a person without a disability just to exist. In the community, we call this the disability tax. This is all the things we pay extra for to live in an accessible world. For many people, this means buying food that meets very specific needs. In my own family, if we do not buy the exact right chicken nugget from the exact right store in the exact right packaging, it will not be eaten by our autistic 9-year-old. For some, this means food that's easy to prepare and still healthy. For others, it's sensory considerations or perhaps very specific diets such as gluten-free or FODMAP diet. Without access to livable income or sufficient staff support, people with disabilities are forced to make food choices that are not in their best interest and oftentimes have long-term health impacts. Limited food budgets may restrict access to healthy protein and produce and create a dependence on highly processed foods that are high in sodium, fat, and sugar. In fact, the CDC cites that 15.9% of adults with a disability have diabetes, compared to only 7.6% of adults without a disability. Options such as food banks are fantastic, but do not typically meet accessibility needs, as most of the foods received there require a lot of preparation or might not meet those dietary standards. If we want to improve life outcomes for people with disabilities, we need to give them proper access to proper nutrition and accessible food. Thank you for your time, and I ask for your support for House File 3426.
Thanks for your testimony and for your work. Appreciate you being with us. Thank you. I want to see if there's anybody else, excuse me, in the audience here who wishes to testify on the bill. And not seeing any. I think Representative Hicks, we're ready to move to member questions. So I guess we'll do that. Questions from members. I am not seeing any from anybody. Representative Zlezikar.
Thank you, Chair, and thank you, Representative Hicks. One of my questions is on the benefit amount. Is that calculation, it says the difference between the maximum benefit amount for a person's household size under the federal SNAP. So I get the household side, but then the actual federal, and then it says the actual federal SNAP benefit amount calculated for the person. But the person is just one person living in the household. So if you're looking at the total income, I'm just wondering if it's equal definitions there.
Representative Hicks.
So the way that SNAP works is the maximum per person is $240 per person. But as a family gets bigger, it goes up to $240 per person. But and I don't remember the exact number, but there is a point where it sort of starts to level off, like each additional person. And so a lot of people with Social Security, so if you're a single mom living on SSDI, for example, you would get so much food support based on your household of two. And so this would fill in the gap of whatever your household of two would qualify for. Because many of these people are getting some, but many are getting like $20 or $40, so they're already eligible for SNAP. So we're going to make up the difference between what their federal number is and their potential eligibility number is. Does that make sense?
Representative Zlezikar? I was kind of wondering about this too. So
Thank you, Chair, and thank you, Rep. Hicks. I guess my question is just, you could be I could be disabled, but my partner or spouse may not be. So the total income for a family could be a blend for eligibility reasons. So I'm just curious as to if that's been thought through in these maximum amount calculated. One is referring to just the benefit by the person, and the other one's is talking about the household. And so the total benefits could be different by a person based on their eligibility with the program, but then their actual income potential for a household could be a blend of various situations. So that I guess is really what my question is. If it was two people together that are equally on the same programs, then it's clear to me. But when it's not clear to me is when it could be different. Thank you.
Representative Hicks, I was actually had a couple similar questions I was eventually going to send to Ms. Sunderman just to warn her, but Representative Hicks, we'll go to you first.
Yes, that is a great question. And we are trying to work out some of the details about how that would be calculated. The key point, though, is that they would have to be eligible for SNAP. So if it was a two-family household where both people one person was disabled and the other person was working, they would have to meet the family household definition to be eligible for SNAP, to be eligible for this position, for this funding. So if one person was on Social Security SSDI and had, let's say, a $1,200 SSDI payment, but the other person was working full-time and earning $3,000 a month, they're going to be over the income limit, so they wouldn't meet the requirement for this program, because the first bullet, the first program in the bill is that they have to already be eligible for SNAP. So the household has to meet the financial requirements on the front side before we would even look at supplementing. I hope that makes sense, but it does get complicated when there are more people in the house, especially if one person is working, but that's why we required that you had to meet the SNAP income initially before we would look at expansion.
Representatives Lesnicar, and again, I was kind of wondering about some of these things too, so we can, but you went first, so you keep on going. Representative Lesnicar. Yeah.
Thank you. No further questions.
Okay. And so then, yeah, I just want to make sure that I'm understanding Representative Hicks and maybe to Ms. Sunderman and House Research as well, that that first you have to be eligible, the income level, as Representative Hicks said, to even be eligible for SNAP in the first place. And then you said it's $240 a person initially, and then as household side goes up, that amount per person starts dropping. I guess maybe, I don't know if you know, Representative Hicks, or maybe Ms. Sunderman does, about at what level that starts dropping?
Maybe it doesn't. I thought there was like an 8%
Representative.
scenario.
Yeah, maybe, Ms. Sunderman, can you just tell, if you, anything you can shed any light on, you may or may not be prepared for this, and you could look into it if not, but kind of how this works mechanically to Representative Lesnicar's questions and mine as well. Ms. Sunderman.
Mr. Chair, members, I do not know sort of the specifics of the benefit amounts and when things start to level off. I believe the income is calculated initially, and that takes household size into account, as most benefits do. So that's where sort of the household size comes in. I can look into the details on the benefit amounts as the household size goes up, though.
I'd love to get more information, if we can, after just the mechanics. I expect Representative Lesnicar would as well, and maybe other members as well, just kind of how the mechanics of this work. Somebody's eligible initially in their household, but then, because when I first looked at this, I sort of thought, well, if you're eligible for a benefit amount, I'm kind of confused about how your household size, but I guess it starts dropping. Anyway, just to understand how the mechanics of that work would be great. So. Other things from members at all? Obviously, Representative Hicks, you got the last word, but Representative Nelson has his, but Representative Hicks, were you going to, should I go to Representative Nelson first or Representative Hicks?
I'll just answer your question,
Oh,
Chair.
please, Representative Hicks.
The reason we don't have a fiscal note is because we're trying to work some of that out too
Oh,
with the department. So
okay.
That's why we have a vision, but we have to get into some of those details. And so that will be worked out as we work through the fiscal note. Given that it's week 2 of session, we're just not quite there.
No, that makes total sense, Representative Hicks. No problem at all. Representative Nelson.
Thank you, Mr. Chair. And this may not be a question specifically to this bill, but, we're hearing 3 bills today, kind of around SNAP benefits and different ways they can be used as, whether it's medicine or disability, individuals with disabilities or things like that. The SNAP program, that is a federal program administered under the USDA, and that program is housed under what is typically known as the Farm Bill, which, ironically, the name Farm Bill, and it's, yes, it's food, but, roughly 80% of that Farm Bill, deals with nutrition and, making sure that food is able to get to the mouths that it needs to. And so I'll just put in a shameless plug here. Let's get the Farm Bill passed for 2024.
Hey, we all would favor
get
that.
Congress to do something. But and I don't know if this is a question maybe for Ms. Sunderman or someone else, but being SNAP is a federal program. Like, how is the Minnesota? What are these bills? How are they? Is there action that we have to do to be able to utilize them in the various areas? Or just, if you can help me understand that a little bit.
Look, that's a great question, as Ms. Sunderman can do her best anyway for now.
So, Mr. Chair, members, receiving federal SNAP benefits is contingent on a lot of compliance by the state across different policy areas. So basically, if the state complies with the requirements, the state receives benefits from the federal government for its SNAP program. And I believe the federal benefits typically, and the federal requirements typically act as a floor for a state. And then the state can invest further into that sort of program.
And so maybe just, it sounds like you're saying that the federal government's providing some kind of, as you say, floor, but a state can say, we want to have more of our residents fed, and, then that might be the case just in the federal program?
Mr. Chair, members, I believe so, assuming that the state stays within the parameters of the federal program.
Yeah, fair enough. Yeah. Representative Nelson, and we certainly, because there may be somebody from DHS as well who could possibly help answer your question. Representative Nelson, back to you.
Yeah, thank you for that. I think that, that's helpful on, understanding that, there's a little bit of a state and federal partnership and, having to stay within the guidelines. I think that's helpful on that.
Okay.
So thank you.
Good, thank you. Thanks for the question. Members, any other questions? Oh, yeah, Representative Watoon.
Mr. Chair, I just wanted to take the opportunity to publicly thank Representative Nelson for kindly hosting my family and I at his farm outside of Hinckley at the end of last session. It was fun, and I think it's really important that we continue to build those bipartisan relationships in the off-season.
Of course, now you figured out that was because he wanted your support for the Farm Bill. Representative Watoon. That was really what was going on, apparently.
I'll contact my congressperson.
Yes, absolutely. Yep. Yeah, and actually, Vice Chair Keeler.
Thank you, Chair. Thank you, Representative Hicks. One thing I really appreciate about you and your work here is bringing light to the disability community. They don't sit at these tables with us often, and you're a fantastic voice for that. I didn't realize, I knew that they had specific food needs. I didn't realize how much more they were spending a year and already a really tight budget on a fixed income most of the time. So thank you for bringing light to this and continuing to fight for a community that really needs your advocacy. I appreciate that in you.
Well said. Well said. Anybody else? Lee Daniels, anything you want to say on this bill at this point? You want to save all your remarks for the end?
I'll speak a little bit now. Thank you.
Okay, yeah. Lee
And
Daniels.
thank you, Vice Chair Keeler, for the comments. That's exactly what I was thinking. I think most everybody around the Capitol knows I'm a big advocate for people with disabilities, and we've got some good legislation passed. I know in my last 10 years here for the autistic community, the Down syndrome community, the people with dyslexia. And so anyway, thank you, Representative Hicks, for the bill. I do have a question. Since this is expansion of a federal program, do we know who's going to pay the extra amount if this passes? Is it going to be federal or state?
I would think it'd be state, but Representative Hicks?
Thank you for the question, Lee Daniels. Yes, the plan is for it to be state, but again, the reason there's not a fiscal is because it's a little bit complicated, so I'm working with the department to try to sort some of those pieces out.
Lee Daniels.
Thank you, and thank you, Chair. So we don't know what it's going to cost. Are we going to wait until we get a fiscal note before this bill goes any further?
Yes, Lee Daniels. Yeah, so the plan actually for all three of these bills is to lay them over, right? We don't have a target yet.
Right.
I think one of the bills might have a fiscal note, but so this is, we're looking at them early in session, but yeah, they will, they're being laid over today.
Okay.
Yeah.
My concern is most projections now will be in a deficit by next year, 26 for sure. So we have to be very prudent on what we pass that has a fiscal note to it. And I just bring up the inflation. It's never been this crazy in my lifetime, and I think I'm the oldest person at the table here. That is just crushing everybody. It's everything that, for a long time the gas prices were $4 a gallon. Well, that started the inflation, and then Bidenomics sure didn't help. That just kind of skyrocketed that. So I just was watching the news last night, and then another rise in inflation is predicted. So if we can get the inflation down, which right now at the current administration, I don't think that's going to happen anytime soon, but I think that's our biggest battle here is to get the inflation down so we're not paying 25% more for groceries. Groceries is the number one, I believe, the highest item that's been impacted by inflation. So, maybe we should look at that problem as well. But as a state, we don't have much to say about it. But that's just my comment, and I appreciate the bill. I think disabilities advocate for is great. This is what we should be doing, but we just have to be fiscally responsible.
Thank you, Lee Daniels. Yeah, well, we know that there was reference that spike in inflation that lasted for a little while anyway, and has really caused folks to be there to be a squeeze, and that's I think partly why this bill is in such response. And of course, we can be really happy, right, that we've had such a strong economy for so long. I think the unemployment rate is about as low as it's ever been, and for as long as it's ever been. So a really, really strong economy from the president and for our country. So good. Representative Hicks, final comments from you on your bill.
No, thank you so much, Chair and members, for hearing this bill. I really appreciate the opportunity to continue to bring the disability community forward to this body.
Thank you so much. Okay, with that, House File 3426 is laid over. And thank you so much, Representative Hicks, for your work and advocacy. And Vice Chair Keeler, I think you are heading on up. And as Vice Chair Keeler heads up, she moves House File 3469 to bring that before the committee. And there is an amendment to the bill. And I'm thinking, Representative Keeler, that maybe we do the author's amendment just to kind of get the bill, do that right away, get the bill in the shape that you wish, if that's okay with you. We'll get everything. Yeah, no problem. We'll get everything settled. So, Vice Chair Keeler, would you like to move the A1 amendment to get the bill in shape, and then we'll move on with the bill?
Sure, can I talk about the amendment?
Of
for a
course, yeah,
second?
please, yeah, totally, yeah. So, and you are moving the A1 amendment?
Correct.
Okay, then please, yeah, talk about it.
Thank you, Chair. And we're handing out a couple information sheets. With yesterday being a holiday, some people didn't get to us until this morning. So now there's more information for you to follow along with us. So the amendment that you have in front of us is a combination of some of the updates that we got back from the agency, because one thing we've learned, or that I've learned in my time here, is working in hand with agencies to make sure implementation is actually feasible and somewhat acceptable to do. So that's what that amendment is. And then this also got the counties a little bit more on board with us, adding the community navigators piece to it, because sometimes the counties are already stretched very thin. This would have an opportunity to have some support in the community to do that work. And so with the amendment, it's putting it in the shape that both the agencies and the counties prefer, which we like teamwork in this space. Thank you, Chair.
Thank you so much, Vice Chair Keeler. And members, are there questions about the amendment? I know that we've gone right straight to the amendment, just figuring it makes sense to get the bill in that shape that works for the agencies and the counties and the bill author. Any questions at all anybody has on the amendment? I am seeing none. So all in favor of approval of the author's amendment, the A1, please say aye. Aye. Any opposed? Okay, so that motion passes. The bill is amended. And so House File 3469, as amended, is before us. Representative Keeler, please proceed.
Thank you, Mr. Chair and members. Good morning. Just want to say on the record, I want to be invited to the farm too.
What's your position on the Farm Bill? That's what Representative Nelson wants to know. Continue.
Yeah, but from teachings that I had from early in my life to growing up, it matters what we put in our body. Food is medicine. As a holistic individual, I know that what I put in my body actually impacts the outcomes of our health. We know that studies tell us that food insecure households spend almost 45% more on healthcare costs than families that have food secure homes. If you know, like I struggle from migraines on a regular basis, and if I put junk in my body one day, the next day I feel it, right? And you know, healthy food tends to cost more. People say that often if you have food insecurities or tight budgets, you shop in the middle of the grocery store because that's where you find the packaged meat or the packaged meals versus produce is usually more expensive, meats is more expensive. My salmon is ridiculously expensive on most days. And so what this bill does is it creates an idea that SNAP is medicine. The food that we put in our body is the medicine that helps us, which then has reduced outcomes in the healthcare sector. So crossing paths in that way I think is really important. With the federal government and the current status of the SNAP program, almost 6,000 Minnesotans who are adults aged 18 to 54 without dependents have lost their access to this, to SNAP or to food access. And 6,000 is 6,000 too many in my mind in Minnesota. And so what this bill does is it does create an adjustment. It's a state-funded program that would allow these individuals to receive $175 worth of food benefits in our state. It is a pilot program. It's a 2-year program, hoping that the feds can pull it together and get the SNAP program back and up and working. But in that time, what this bill does is hopefully fills those gaps. It is scalable. In the information that we passed out, you'll see per county, these are the numbers of individuals just in the last 2 months who have actually lost their SNAP benefits. And so you can see your own county, where you stand, and some of the surrounding counties. But with the county the county breakdown in different populations, we do feel this could be scalable if this is something that we move forward with this year. With that, Mr. Chair, I'll move to my testifiers.
Thank you. And so first testifier, Jessica Webster, please identify yourself, share your pronouns if you're comfortable, and proceed.
Thank you, Mr. Chair, members of the committee. My name is Jessica Webster, she, her. I'm a staff attorney with Legal Aid. And right out of the gate, Mr. Chair, thank you for hearing this bill about adults ages 18 to 54 who've lost SNAP benefits under federal time limits. You know, in my 18 years with Legal Aid, this has been a very difficult group to get attention and empathy for, frankly. I think as a society, we're having more thoughtful conversations about disabilities, also about mental illness, addiction, homelessness, trauma. I know this committee is really well versed in ACEs scores. These things are all present in this population of adults. And what we don't always talk about is how those challenges show up to affect employability and work. And the quiet part out loud is that employers aren't always clamoring to hire these folks full-time or getting as many hours as they need to be able to access SNAP under federal requirements. Unfortunately, Congress has created a very blunt tool with federal time limits for these adults who are asking for help with food. And federal law cuts people off without really requiring a thorough conversation about what's going on in their lives. And there's not really much of an evaluation before food gets cut off, before this entitlement gets cut off. We now have more than 2 decades of evidence that show that these time limits are not improving employment outcomes. I think depending on your perch, people look at these time limits as either punishing folks who aren't meeting enough work hours or as trying to motivate folks to meet work hours. And really, neither of those things are bearing out. What we do have in Minnesota is a very recent Johns Hopkins study that looked at our Medicaid population and looked at single adults who have become disconnected from food and how sick they are, that they're dealing with chronic health problems, untreated conditions related to their disabilities, and other health issues and expenses. So we're grateful to Representative Keeler for bringing this bill forward. It's not a permanent solution. It's a temporary pilot. As she said, it's scalable due to budget constraints. I'm sure we won't be able to serve all 6,000 adults, but we do think it's a good start. We support the bill, and we appreciate that she brought it.
And thank you for your testimony, for your work. One clarification, Ms. Webster, you were mentioning the time limits. Can you give us a sense as to just sort of what sorts of time limits apply? If you can, just a little more detail on that, if you can.
Thank you, Mr. Chair. So the federal time limits, which have gotten a little more aggressive in the last few years, are an adult can get SNAP benefits 3 months out of every 3 years if they're not meeting a 20-hour-a-week work requirement, or if they're not eligible for an exemption. And the reason that this bill is so relevant is that Legal Aid and other advocates actually believe there are a tremendous number of people in this 6,000 that are eligible for exemptions. We just think we need to connect with them and help them reconnect to SNAP benefits by getting a current doctor's statement, a current mental health evaluation, a statement from that they are homeless, a statement of their veteran status. Oh. Those are the types of things that we could help people get reconnected to federal benefits on.
And so there can be exemptions to those time limits, but the way that they're structured, the thinking is there's plenty of people in there who could qualify. They just haven't been able to get that support.
Thank you, Mr. Chair. That's accurate.
Okay, good. Thank you so much. We'll move to the other testifiers, and then discussion of Lisa Lane and Peter Wojtak, I think, are the other two we have. I think Ms. Walsh will not be testifying on this bill. So Lisa Lane, make your way on up. Thanks so much to Jessica Webster. And once you settled yourself in, please identify yourself, proceed.
Thank you very much, Mr. Chair, and thank you for the opportunity to present to you in support of House File 3469. My name is Lisa Lane, and I am the Director of Public Policy at Open Arms of Minnesota, a food as medicine organization. For nearly 40 years, Open Arms has been preparing and delivering healthy, nourishing, and made-from-scratch meals to vulnerable, sick, and food insecure Minnesotans. with the help of 4,000 plus volunteers who help make meals from scratch in our 2 kitchens, one in the East Phillips neighborhood and of South Minneapolis, and our newest kitchen on the west side of St. Paul. We prepare nearly 2 million meals per year, and we deliver and ship those meals to thousands of Minnesotans who are living with critical and chronic illness. Our team of registered dietitians and trained chefs work together with our team of client service staff and client healthcare providers to develop and prepare our nutritious meals. We know that healthy nutrition makes a difference. According to the Journal of Urban Health, when individuals received regular nutritious meals, they also experienced decreased depressive symptoms and decreased binge drinking. Further, research from Tufts University unequivocally states that access to healthy food improves health outcomes in general, including a 70% drop in emergency room visits and a 50% decrease in hospitalizations overall, resulting in a $13.6 billion savings for our healthcare systems. We support SNAP as medicine because we have seen firsthand the impact of food as medicine to increase healthy outcomes, especially to serve vulnerable adults who are at a significant risk of hunger and malnourishment. SNAP as medicine is a compassionate and pragmatic approach to addressing the holistic well-being of at-risk populations. At Open Arms, we have learned that chronic health conditions, whether mental or physical, often impact various aspects of an individual's life, including their ability to maintain stable employment and financial security. Access to SNAP as medicine can provide crucial assistance in ensuring access to nutritious food, which in turn can positively influence health outcomes. Adequate nutrition plays a pivotal role in mood regulation and cognitive function. Furthermore, promoting access to meals through this legislation supports is a comprehensive approach to mental health care, recognizing that physical and mental well-being are intricately connected. Support of SNAP as medicine extends and underscores the importance of addressing the multifaceted needs of individuals to enhance their overall quality of life and facilitate their journey towards mental and physical wellness. Investing in nutritious food now helps reduce hospital visits, and it saves money. It provides hope and comfort for a group of people who are often forgotten or left behind. It is not overstating to tell you that healthy meals comprised of good nutrition really does save lives. On behalf of all of our clients, our staff dedicated to serving them, and our volunteers who give their time, thank you for your time and consideration of House File 3469.
Thank you. Thanks for your testimony and for your work. And I think there was one other person, Matt Freeman. Oh, I'm sorry, no, Peter Wojtak. I'm sorry. That'll be after that. Mr. Freeman will, but Peter Wojtak will have you back on up. And then you've introduced yourself previously, so you can just dive on in with your testimony.
Thank you, Mr. Chair. Here to testify in support of House File 3469. And so just want to say SNAP is really our most effective tool to fight hunger in the state. It provides targeted assistance to very low-income individuals and families and key vulnerable populations who rely on nutritious foods to keep them healthy. It also lifts people out of poverty and relieves pressure on the overwhelmed emergency food system, which we know are doing all they can to try and meet the needs growing across the state. And because we operate the Minnesota Helpline at Hunger Solutions Minnesota, we know that navigating the SNAP application process can be hard and keeping benefits can be harder. So even if someone is likely on top of deadlines and paperwork, it can be a struggle. Missing a mailing could mean you lose benefits and get cut off and have to start all over again. So one of the challenges that we see with people, especially the time-limited SNAP population, is they aren't always in the most stable of housing situations and tend to move more than the general population, so they can miss a mailing a little bit easier. And so that's why it's so important to have that friendly voice on the phone explaining and confirming the information in the letter. But for many time-limited recipients, it can be difficult, like Jess said, to navigate that system to meet those exemptions, especially for those who face challenges from homelessness, addiction, mental health access, and access to transportation. So this is why we feel it's really important to restore SNAP benefits to those Minnesotans who lost food support due to the federal time limits, and to help make sure they're able to put food on the table during this difficult time. So thank you for your consideration and support of the issue.
Thank you so much. Thank you. And then Matt Freeman, I think, is our last testifier. And so once you settle in, identify yourself, share pronouns if you're comfortable with that, and proceed.
He, him. Chair Pinto, Matt Freeman. Thank you, committee. Here on behalf of the Minnesota Association of County Social Service Administrators and the Association of Minnesota Counties, here to share comments on the SNAP as Medicine program. I want to start out just by thanking Chair Pinto, Vice Chair Keeler for dedicating an entire hearing to this issue of food insecurity and many approaches to addressing it in our state and in our communities. On a personal note, SNAP is close to my heart. It's something my grandfather worked hard on in the 50s and 60s as well. Counties support ensuring access to SNAP and for all eligible Minnesotans. And counties know that continuity and access to SNAP will help low-income Minnesotans achieve economic stability. We appreciate that the advocates working on this legislation have solicited county input, and given the holiday, we haven't been able to go through the current amendment, but we believe that the changes were made with the intent to make this legislation more workable for state and for counties, and we greatly appreciate that. Counties seek to ensure the processes and procedures outlined in the bill are feasible for counties to enact so that the potential benefits would really be realized by those receiving benefits, and it appears that those updates are being included. We look forward to continuing to work on this with advocates and Representative Keeler, and thank you so much.
Thank you, Mr. Freeman. Anybody else who wishes to testify on this bill? We'll find that out first. Not seeing anybody. And so we can move to member questions and discussion. Representative Perez-Vega.
Thank you, Mr. Chair. Thank you, Representative Keeler. I just want to address how important HF 3469 is as somebody who has a chronic illness and thinks of so many of my constituents who speak with me who don't get the required support for the food that keeps them alive. And food is medicine. It's just as important as we need our clean water that folks need access. And with what we've seen in our prior research with Hunger Minnesota, this great display of showcasing the need and the importance that we need to do better in Minnesota to address that food is medicine. It's a livelihood. It's not just filling up and saying, hey guys, there's a little bit of food on this end. Some folks really need to actually have food to make sure that they can wake up in the morning a little bit more than everyone else. And this here addresses that. So thank you for making sure that folks know that food is medicine. SNAP is. Thank you.
Thank you, Representative Perez-Vega. Representative Hicks.
Representative Keeler, thank you so much for this bill. As your testifiers were talking, I was taken back to my days as a baby little community worker. And I was supporting a young man who was a senior in high school. He had turned 18 and his mom had kicked him out. And the school had referred him to me because he was on an IEP for independent living skills. And I was like 24 and knew nothing. And he was on SNAP. And I didn't understand that there were federal work requirements and that SNAP was going to end so quickly. And it ended, and he had no food. He was working with vocational rehabilitation, but his family had never connected him with social services, and he had a developmental disability, but his IQ was out of date for the requirements that the county was requiring because it hadn't been done since he was 9. And his IQ was like 60. And so he was moderately developmentally delayed, and he was now homeless, didn't have the right documentation to extend his SNAP. Because he was a single male with no children, he wasn't eligible for any financial support. He was couch hopping. And I distinctly remember, leaving one day after he was at a friend's house, and sitting in my car, shutting the door, and just sobbing. Because it made no sense to me that this young man who had done nothing wrong was getting no support because he didn't know how to navigate a system. And now we were starving him on top of everything else. And I will never forget that young man. And this program fixes that for young people like him and for other people. And so I just want to say thank you so much for bringing this bill, because until you've had to navigate the system of getting the right piece of paper, the right documentation, the right whatever, you don't understand how difficult that process is. And so thank you for this, and thank you for the amendment to include those navigators. I think that's really an important part, and I'm grateful that you've been able to collaborate with folks to bring this forward. Thank you.
Thank you, Representative Hicks. Representative Coulter.
Excuse me. Thank you, Mr. Chair. And I want to echo all of my colleagues' comments and thank Representative Keeler for bringing forward this bill. And I think what really strikes me is I think this is another opportunity for us to really show how food insecurity, and in particular this issue of SNAP case closures due to time limits, really is a statewide issue. It is not unique to any community in our state. I did the math, and of these case closures by county, about 40% come from greater Minnesota. And that's about the proportion of the population of the state that lives in greater Minnesota. So the idea that for example, this might be overrepresented in the metro is simply not true. But the number that jumped out to me was the number from my own county, Hennepin County, where something like close to 40% of these case closures come from. And the reason I bring this up is because I think there is a very popular misconception that Hennepin County is so heavily dominated by Minneapolis. And the reality is that 2/3 of Hennepin County is suburbs. It's not Minneapolis. It's communities like mine and Representative Katiza-Tunes. And even if those numbers are over-representative of Minneapolis, we're still looking at something like a fourth or a fifth of these overall case closures coming from Hennepin County suburbs. And so I think it is just important to recognize that, and I do hope this moves forward, that this program will serve everyone in the state. It will serve everyone in every single one of our communities and make life just a little bit easier, a little bit better for folks in all of our communities. And that, I think, is just something that we really need to make sure we're focusing on. Thank you.
Thank you so much. Looking to see any other questions. Representative Davis.
Thank you, Mr. Chair. Thank you, Representative Keeler. I want to make sure I understand what the purpose of this program is for. It's so that people who already are eligible for SNAP have access or more access to healthy food to help benefit their mental health, correct?
I think that's not quite right. Representative Keeler or Ms. Webster, either one. Vice Chair Keeler, looks like you're going for it.
Thanks, Chair. Thanks, Representative. I think it's more than just mental health. I think it's overall health as a whole. I mean, we know, and yes, a lot of them are eligible. They maybe just don't have the resources to complete the right steps. That's why the community navigators are going to be so important. Because we know, and I can let my testifier add a little bit more, but in the work that we do in the community, we know a lot of these individuals would be eligible because of their homelessness status or veteran status or disability or illness status. And so I would say it's more than just mental health. I look at it more as like our holistic health. So it's mental health, mental, spiritual, emotional, and physical all together is better. And also when you look at it from more of an investment lane, because as I said at the beginning, when we invest in food, it actually has a pretty significant reduction in our healthcare costs. So just kind of moving that if we help individuals have healthy food, they would have overall better healthcare outcomes. But I'll let my testifier answer more.
Ms. Webster. Thank you, Mr. Chair. Ms. Webster.
Mr. Chair, Representative, I think just the clarification is income eligible. So these are low-income folks who would be income eligible, but they've lost SNAP due to this federal time limit rule. And you know, in legal aid's work, when folks get to us and they say, you know, I just lost SNAP due to the federal time limit, legal aid is often able to get them reconnected because of a barrier or a challenge. It's very rare that we have someone come in who is completely able to work full-time and is not working full-time and just wants to get SNAP benefits. That's not our experience. Our experience is folks have some barriers to employment. We're able to identify what those are. They're homeless, they're precariously housed, they're ill, and we can help them reconnect to federal SNAP benefits, which would not be a cost to the state. It would be reconnecting them to federal benefits. But in the meantime, there would be this bridge of a state benefit.
Representative Davis.
Thank you for the clarification. Yeah, and I guess as I'm reading through the bill, when I did catch that when I see health outcomes, I kept thinking mental health for some reason. But yeah, so it's clearly right there. So the way this is laid out, it'll be provided at $175 per month for the purpose of people getting access to healthy food, correct? Again, I just want to make sure I'm
Make
understanding.
sure I understand. Ms. Webster.
Mr. Chair, Representative, it would be for SNAP access, to have SNAP benefits to be able to purchase food.
Representative, and maybe I'll just, and is that the amount of a federal SNAP benefit, the $175, Ms. Webster? Or-
Mr. Chair, it's actually a reduced benefit.
That's
We
less.
scaled it down a little bit.
Okay, Representative Davis.
Okay, and again, forgive me if I'm misunderstanding, but I just want to make sure I understand this. So when I read the bill and I read these other notes here, the focus is on health, improving my health. And I'm just wondering, I'll just get the question out there. How do we make sure that there's accountability with, hey, they're actually purchasing food that's healthy for them when it comes to this benefit?
That may kind of go to the structure of SNAP to begin with. Ms. Webster.
Mr. Chair, there is no requirement in this bill right now on restrictions on what type of food you purchase in the store. And I think the conversation about inflation, particularly is part of that, in that if we restricted that you could only purchase fruits and vegetables and meat and these things, your benefit wouldn't go as far, frankly. And so if we wanted to have a conversation about, how to bolster some of the healthy components of it, I think there are other pieces of legislation around market bucks and other programs that are really incentivizing and bolstering the healthy food purchases within SNAP. But this one is to make sure people just have food, just access to food, a SNAP benefit.
And can I just clarify, Ms. Webster, the restrictions under this program are the same, or the setup is the same as under federal SNAP, right? So it's the same restrictions or lack thereof.
Mr. Chair, that's correct. Thank you.
Representative Davis, back to you.
Thank you. I get it. So another question for you. Our caseworkers at the county are already overloaded big time. Like, is this bill taking into any consideration? We're going to be putting a heavier load on caseworkers. Is there a cost involved? Is that considered in the bill as well as we're working through this? Like, what if counties have to hire more caseworkers? Like, are we taking into consideration money that will need to be spent there? Does that make sense, that question?
Looking to Vice Chair Keeler, I think, or Ms. Webster, either one. Ms. Webster.
Thank you, Mr. Chair. We were sensitive to that in this bill. So right now, DHS has asked counties to make sure that folks who are eligible for federal SNAP, that they look at some things before they closed folks. I think DHS has actually done a rather heroic job of trying to work with counties, and some counties have done a heroic job in trying to keep people connected. But right now, the piece that you see about the community navigator is the piece where we wanted to be sensitive to county workload on this, and we're hoping that counties could work with Legal Aid, Hunger Solutions, Second Harvest. We are not funded in the bill, but we do SNAP outreach, and we're pretty good at helping people get connected to SNAP benefits. And so that is the piece where we wanted to recognize county workloads.
And I'll note Mr. Freeman represents county social workers and social service administrators, and he did testify in favor. So, but Representative Davis, and then we've got another bill to get to, so we do need to keep moving. Representative Davis.
Yep.
On a piece? Yeah.
Again, Mr. Chair, thank you. We're laying this over.
We are,
so
yeah,
We're going to
correct.
continue to
There'll
work
be other
through this and
conversations.
figure out costs. I would just like to bring that up, that we really need to think hard about what extra costs can be incurred at a county level. Thank you, Mr. Chair.
Thank you, Representative Davis. Yeah, we'll be coming back up. I think we've got Representative Katiza-Wattoon, real quick if you can, and then we'll go to Lee Daniels, and then, of course, the author.
Thank you, Mr. Chair. And Vice Chair Keeler, thank you so much for bringing this forward. I think, so I personally believe in the old idiom of an ounce of prevention is worth a pound of cure. And I think that many of the issues that we consider in front of this committee are part of that, right? We look at what the state is spending on healthcare costs for publicly funded programs and for folks who can't afford or don't have an employer-based program. People who are eligible for SNAP or who are food insecure, they spend 45% more on healthcare costs every year than food secure households. So I think if we just look at that one piece and we're making this investment and we're ensuring that people can get the nutrition that they need and don't have hungry bellies and can go on to school to actually learn. Like, now kids get food at school, and they can actually learn, and they can go to work, and they can, go on to be positively contributing members of society because they're not worrying about where their next meal is going to come from. That impacts the other places that we're already spending this money. And I think that it's really critical to consider some of the different levers that we can pull and make sure that people are getting the support that they need so that in return, down the line, they're able to give back in a different way.
Thank you. Thank you, Representative Katiza-Batun. Lee Daniels, want to go briefly on this one? Do you want to do the two of them at the end, or how do you represent Lee Daniels?
Let Representative Zelinsgar do my closing.
Oh, okay. Representative Zelinsgar.
She's got a good point.
Okay, Representative Zelinsgar.
Thank you, Chair, and thank you, Rep. Keeler. I appreciate the bills that both Representative Hicks and Representative Keeler have brought forth today. I know that you're both passionate on serving people with disabilities, and I've spent my life caring for the same group the last 40 years. And so to the point, there's a few points I want to make, but to the point of how complicated the processes are in government for applications is very true. And so many times, my experience has been people just don't have the knowledge and they don't have the resources of connections to even know what to fill out. So one of the things that I think, and I like the navigator piece of this, one of the things that I think is critical that we look at is the 175 a month is a piece of this, and then we have the issues going on where we have boarding in the hospital ERs. I was just on a conference call yesterday, as many of you were, and I see it. I've been a patient in the hospitals, and I've also been in this capacity and also in healthcare for 40 years. And so I think it's really critical that we look at what's happening in our state, because we have mental health. We have 40% increase in mental health since the pandemic. We have the stopping of pandemic benefits. And so we have this new level we have to create. And so my thing I'm looking at is just what are the partnerships between the counties to assess and to identify what the needs are, whether it's veteran benefits, mental health benefits, diagnostic levels. What are we doing to reach the people? We have food shelf areas. Most of us, I think we all voted to support the food shelf and how critical it is here. But the reality is we do have a low unemployment, but we have the highest need. And so we have an issue going on in the state that we have to address. And so we have to find ways to reach the people. I do see that the current mental health evaluations and these untreated situations, and then, emergency rooms have a lot of data. Who's continually coming through the emergency rooms that are, if they're serving all people for whatever reason they come in. And so if you ask nurses, they'll say there's sometimes people are coming in because they're hungry, So that's a highest cost access in those situations, or mental health screening or behavioral health. And my second comment is that we are losing behavioral health beds across the state at a rapid pace. And we are shipping kids to Fargo as we sit at this committee right now talking about children. We do not have enough behavioral health beds in the state. And so as we're looking at issues for children and adults, I think the emergency rooms and the hospitals and the providers have a lot of data, and we have to look at this whole piece. I do see a pathway that there's probably benefits.
We need to wrap up really quick, just
Yeah.
we have another whole bill to do.
There's probably many of these benefits that they would be federally eligible for if they were getting the screenings timely. And some of those costs shouldn't be at the state, but we don't have the systems in place, so we have to be collaborating between our state government programs better and more efficiently. And they won't fall through the gaps as much as they have been. And so I appreciate the initiative. I think we just need to look at the whole big picture.
Thank you so much, Representative Zelinsgar. Turning to Vice Chair Keeler for final comments on this bill. Madam
Thank
Vice
you,
Chair.
Chair and members. And thank you, Representative Zelinsgar, for giving me the opportunity to plug the fact that most of our kids go to Fargo. And so that's why one of the bills we're working on is a psychiatric residential treatment facility in Clay County so that we can actually keep kids in Minnesota to house them, work on the supports that they need within our state. So thank you for giving me the opportunity to plug that, because we do understand this is a very widespread issue. At the end of the day, though, I said it over and over last year, when we're hungry, we're hangry, and I'm pretty sure all of you had breakfast or at least know where you're going to eat lunch or have a dinner plan in mind. And when you don't have that, it is hard to be the best person that you can be and show up, be the best that you can for yourself, for your family, and your community. So thank you for the robust discussion, and continue to look forward how we can feed Minnesota. Thank you.
Thank you so much, Vice Chair Keeler. Thank you, Ms. Webster, for a really powerful bill and a good conversation about it. So Chair Gomez, come on up. Sorry that we're a little bit later than I'd like, because this is an important bill too. So I will ask if, as Vice Chair Keeler settles in, if she's willing to move House File 3855 to bring that before us.
I move House File 3855 in front of us, Chair.
Thank you, Madam Vice Chair. And Chair Gomez, I think this is your first time before a committee. So glad to have you, and please present your bill.
Thank you, Mr. Chair. It is my first time. Great to see everybody. I'm so happy this committee exists to think about our families and children in our state. So 3855 is a bill that will provide greater flexibility to SNAP recipients by asking DHS to participate in the restaurant meals program through the USDA. So this program basically is an option that allows certain SNAP clients who might not be able to prepare meals themselves because they don't have permanent housing to prepare and store food, or they're not able to do that for various reasons related to disability, to be able to buy prepared meals with their SNAP benefits. 9 other states currently participate in this program through the USDA. And it's called the Restaurant Meals Program, but really this is just allows SNAP benefits to be used on prepared meals at already certified EBT retailers, so like grocery stores. There's some weird, bizarre and kind of arbitrary limits to SNAP benefits. So you can go to the deli counter and you can buy a cold rotisserie chicken that was prepared at the deli, but you can't just buy the exact same chicken hot because it's considered a hot prepared meal, and that's not eligible. If you have EBT benefits, you can go to Papa Murphy's Take and Bake Pizza. You can buy pizzas and bring those home and cook them in your oven, but you can't buy a prepared pizza. Nor can you can get the Take and Bake, but you also can't go to the store deli and get a cup of chicken soup that's hot. So it's sort of I think it was originally rooted in we don't want people to use EBT benefits on fast food, but it has resulted in some strange externalities, I think. So to be eligible for this program, you have to be certified for SNAP, and all members of the household must either be 60 or older, disabled, homeless, or the spouse of a SNAP client who's eligible for the program. So this doesn't have a direct cost to the state. It's really just directing DHS to ask USDA to opt us into this existing program. It's the right thing to do. I think it will be good for Minnesotans, and I hope I'm thankful for your consideration.
Thank you so much, Chair Gomez. And I'll point out that there's a great handout from Ramsey County describing the bill with details too. And so another person we're so delighted to have with us is former Rep and Chair Rena Moran. And so Commissioner, please identify yourself. So glad to have you with us, and proceed.
Well, good morning. And thank you, Mr. Chair and members, for having me at committee this morning and for hearing this bill. I am Ramsey County Commissioner Rena Moran. So participation in this federal program is important because people who are unstably housed may not have access to a kitchen to cook or the ability to heat up food. Elderly or disabled individuals may have a difficult time preparing foods. In addition, this change will encourage more to apply for SNAP. Minnesota has one of the lowest SNAP participation rates among those who qualify. I have some data to share to highlight why this change is beneficial. In 2022, over 17,000 SNAP recipients in Ramsey County were over the age of 55, approximately 20% of the overall SNAP participants. At the population ages, these rates are expected to increase as adults over 65 are the fastest growing age group of Ramsey County residents. Across Minnesota, 33% of SNAP participants are in families with members who are elderly or with a disability. As for individuals who are unstably housed, in 2023 point-in-time count, 1,680 homeless individuals were identified in Ramsey County. 177 were youth, 107 were veterans. Racial disparities in home ownership and difficulties accessing affordable housing are reflected in Ramsey County unhoused population, with 70% reported as a person of color. So we know that all of these groups of people matter in Minnesota and in Ramsey County. By participating in the restaurant meal program, which we know that this name is a little deceptive because SNAP participant cannot purchase or will not be able to purchase food in a restaurant, but instead our SNAP participant would have the option to do something as simply as go to a grocery store, pick up a rotisserie chicken that is hot, with maybe some mashed potatoes from the deli, and enjoy a hot meal even when they're unable to cook it for themselves. So we want to thank you for allowing us to have this hearing and for your support.
Thank you so much, Commissioner. Anybody else from the audience who wish to testify on this bill? Not hearing any, and so we can move to member discussion. I should note that my understanding from fiscal staff is that there actually might be a small cost, and so we will be laying this over today, but we'll get that information. So, member discussion or questions? Representative Davis, yeah.
Thank you, Mr. Chair. So, Representative Gomez, can someone, like if McDonald's has it set up where you can use EBT as a debit card, can someone take this benefit and go spend it at McDonald's?
Chair Gomez.
Thanks, Mr. Chair and Representative Davis. That's not like a thing, I don't think. McDonald's doesn't accept EBT, no fast food restaurant accepts EBT. The EBT providers, or I mean, the kind of group of places where you can use EBT are like grocery stores, some corner stores, other places that sell fresh prepared food. So one of the requirements to be enrolled in EBT is about the mix of products that you provide. So that's why when Commissioner and I were talking about like examples of grocery store delis, because that's kind of like mostly what this expansion impacts. But no, there's no fast food restaurant or anything like that, or any like restaurant that would accept EBT, at least in Minnesota.
Representative Davis.
Thank you. Thank you for that, Representative Gomez. And just kind of entertain where I'm going with this. But what if McDonald's does set up something? If they did that, could you use this money at McDonald's?
Chair Gomez.
Or this benefit, excuse me.
Yeah, Chair Pinto. So I don't know exactly the mix of products that you have to have in your store to participate in EBT, but I know that it is set out in law. So I suppose if we're going down a thought experiment, if McDonald's completely changed their entire business model and instead of selling hamburgers and French fries, they decided to sell fresh produce, meats, grains, other foods, sure, you could have a place called McDonald's that you could use EBT should they, like I said, completely transform everything they're doing. But under the current McDonald's, as we all understand it, there is no possibility under federal law that McDonald's would ever be a certified EBT kind of provider.
Representative Davis.
Thank you, Representative Gomez. Stranger things have happened. Thank you.
Representatives, I thought I saw that. So I had Representative Perez Vega. Go to you. Yep.
Thank you, Mr. Chair, and thank you, Representative Gomez. And it's just great to see a former state representative here, but now leading in Ramsey County. I know how important it is, especially in Ramsey County, speaking with several constituents. I recall one of them stating that, she couldn't cook anymore, and she hated the fact that she couldn't cook a warm meal anymore, and it was difficult to just, grateful for the products, but it is really important, especially for the folks that I think, and I don't want to name this woman, but when I seen that this was being brought up today, I thought about her and the conversation that we held, that she can go to Lund's and she can use her SNAP card there, but unfortunately she can't even prepare her own meal, what she's able to get with that SNAP card. So I think the importance is how we are accommodating, especially to folks with disabilities, our elders, and who qualify for this program. So thank you for bringing this, and I look forward to supporting it. Gracias.
Thanks, Representative Perez Vega. Representative Hicks. Representative Hicks.
Thank you, and I love this. Thank you so much. I also found the checklist from it looks like it's a business association for merchants. And it appears from the checklist that more than 50% of your food has to be cold. You have to stock 3 different dairy items, 3 different bread items, 3 or more different types of meat, poultry, fish. So I think it would be really hard for McDonald's to do it. 3 different vegetables and fruits. Yeah, so those would be the requirements that are currently on the checklist that I looked up from the USDA. So.
Thank you. Representative Lee.
Thank you, Mr. Chair. I just want to thank Chair Gomez for bringing this really important bill in front of our committee. I have a lot of seniors in my district who I know this will help immensely because they don't have access to, big kitchens, right? And are maybe unable to, stand and cook for long periods of time. And so really appreciate that. And also want to just reorient us to what the bill does because it opts us into a federal program to optimize the way we can help Minnesota residents and particularly our seniors who are limited in income and, as we talked about earlier, right? Probably struggling to make ends meet now that pandemic relief has ended. And so appreciate your work on this.
Thank you. And, okay, so Chair Gomez, we have a tradition in this committee of giving Lee Daniels the final word before the bill author. So Lee Daniels.
Thank you, Chair. Thank you for bringing this bill forward, Chair Gomez. Nice to see you again, Commissioner.
Good to see you.
I like the idea of this. My wife and I did Meals on Wheels for a number of years. It's kind of like that without the wheels, I guess. Nutritious meals, as my legs got worse, I was the chauffeur. My wife would go up in the apartments and knock on the door, but I got to do a couple of years of that. And it was, these people are just, really happy to see you. The only thing I would ask is all 3 bills today don't have no fiscal note, and we know that's might be a problem down the road, but laid over for possible inclusion. Hopefully get a note and then decide where the budget's at and whatever forecast should be coming out, in a week or so, I think. But anyway, the premise of the bill, the only thing I would say about it is part of my brain is saying, but if you bought all these groceries separate and made it yourself, it'd be a lot cheaper. But then a lot of testifiers were saying that they don't have a place to do that. So my right half of the brain is struggling with the left half of the brain. But overall, I think...
Both your left half.
Yeah, both my left half. I had brain surgery. Give me a break here.
Fair enough.
It's scrambled up here. Believe me, it's a mess. But anyway, the premise of the bill I think is very good because it's like Meals on Wheels without the wheels. So I appreciate you bringing it forward.
Thank you, Lee. And I think the name of the program has been bothering a number of us, and so I think perhaps we can, as it moves forward, we're going to have staff look into whether at least in our statute we rename it, and we've got a great name now, Meals Without Wheels. So we'll see if we can look into that. Chair Gomez, you get the last word.
Thank you, Mr. Chair. I'm not sure if I misspoke in my opening comments, but I did see Mr. Doug Berg jump to his feet, and I was like, oh no, I must have said something wrong. So I was trying to say that there was the direct costs of this program, the costs of the food, the costs of the actual rotisserie chicken that you could go get are not borne by the state. That's obviously funded through SNAP, which is a federal program. I don't doubt that that DHS will come up with at least some small administrative costs for this. I'm sure you guys have no experience with that. Anyway, so I thank you so much for your consideration today, and thanks for the conversation, and I hope that we can move this forward.
Thank you so much, Chair Gomez. A terrific bill. And thanks to you and to Vice Chair Keeler and Representative Hicks, all of you bringing your passion and compassion, making sure that we're living out our compassion, as we certainly should, for people struggling on this and so many other issues as well. So thank you for the discussion. With that, Chair lays over House File 3855. And I believe that we are all done, and we'll look forward to seeing folks on Thursday. With that, the meeting is adjourned.